Hey, guy, the COVID pandemic, it's over. Well, why do you think that? The acronyms, they said so. They said it was over. Well, actually, the CDC and the WHO said that the pandemic was not over. One announced the end to the public health emergency, and the other basically said, we failed. Yeah, the public health emergency, you said it's over. That means COVID is over. No. So the CDC, the Center for Disease Control and Prevention, they're the ones that ended the US public health emergency, which basically was the way for the federal government to give everyone more flexibility to be able to address the giant emergency that COVID became, and still is. A public health emergency is basically a 90-day rolling document where they say, we're going to allow all these things for this period of time, and then when the 90 days is up, we're going to either renew it or end it. So think of this in terms of the government doing federal funding or deciding to stop giving money for COVID. Well, what were they even doing then? And then why does it even matter? So what? The end of the public health emergency. People don't deserve money. Well, let's just go over what the end of the public health emergency actually includes. Calling an end to this means that the government is going to stop providing free vaccines, boosters, and testing, in addition to any COVID-related drugs you might need, like Paxlovid, for treating the symptoms of your COVID infection and post-COVID infections. So now you're going to have to pay out of pocket if you do get COVID and you get sick to get treated. Additionally, a bunch of people were enrolled in Medicare and Medicaid, and millions of people, adults and children included, are going to get kicked off of their health insurance plan. Additionally, the government is no longer requiring COVID tracking. So if you go to the hospital for COVID, they're not recording it, they're not obligated to, and then if you get a lab test, like a PCR test, the labs don't have to report it. So we have no idea how COVID is currently spreading within the states. All right, that makes sense, whatever. But the WHO, they said it was over. So unfortunately, this came down to a lot of really bad messaging and bad timing between the WHO and the CDC. So the World Health Organization, the WHO, they're put in place to sort of protect everyone in the globe. They basically said we failed to contain the COVID virus. It is now well established and it's ongoing. So we're ending the public health emergency of international concern. Aha, see? Public health emergency of international concern. They stopped it. That means COVID's over. No, this is wrong. No, that's not right. So the WHO basically has this thing that if a brand new disease pops up, they call it a public health emergency of international concern. If it's a sudden, serious, and unusual situation where it's a virus that just sprung up out of nowhere that we haven't seen before, like COVID. And then they mandate measures to everyone in the globe to try and contain it to just a singular location and then to eradicate it within that location. So the WHO is trying to institute these measures to stop it from spreading in the first place. So calling an end to that public health emergency of international concern, simply all it meant was them conceding we failed to contain the virus. We did not do our job. It is now everywhere and it's still ongoing and we failed in our efforts. So it's still ongoing then? Yeah, unfortunately the pandemic is still going and we're finding how bad the virus truly is.